So I think every year we ask ourselves this question, if there's still a role for stem cell transplant in multiple myeloma. And I would say in 2021, yes, there's firmly a role for stem cell transplant. So of course, a few years ago, we got the results from the IFM 2009 trial, which compared upfront transplant versus delayed transplant after VRD induction. And upfront transplant led to deeper MRD negativity and longer progression-free survival. Well, then we asked, what if we used KRD induction? And Dr. Francesca Gay and her group have done this amazing trial called the FORTE trial, in which patients, there were 3 arms for induction, but I want to focus on the 2 arms, one of which got KRD followed by transplant, and the other which just got KRD. And eventually patients went on to maintenance with either KR, which is Carfilzomib Revlimid, or just Revlimid alone. And clearly there was a superior progression-free survival in patients who got early transplant than just continuing Carfilzomib, Lenalidomide, Dex followed by maintenance. And this benefit was present across all subgroups, standard risk patients as well as high risk patients. So I think in 2021, upfront transplant is the way to go. Now, there are some patients who might not be able to take that time off for transplant. If they're standard risk, I can sometimes offer them to collect stem cells and do it at the time of relapse because we know the overall survival is similar. But my very strong preference is to do it upfront and give patients the best treatment upfront.